concentrate on a particular company. Mangalam just mentioned that Krsnaa Diagnostics is launching retail healthcare services across India. We do have the management of Krsnaa Diagnostics, which is joining in to discuss exactly this. They will be launching 600 diagnostic centers across the country. And the center will offer specialized services in a host of segments. To discuss more about this, Pallavi Jain, who is the MD of the company, now joins in. Pallavi, hi, thank you very much for joining in. So I just want to, just get this clarification out of the way. These 600 new centers that you are launching are simply diagnostic centers that you will be launching across the country. So your press release clearly says that it will be equipped to offer specialized services in precision medicine, genetics, genomics, molecular diagnostics, which a lot of diagnostic companies already offer. Secondly, it will also provide routine investigations as well as possibly dedicated services for women's health, which is hormones, PCOD, diabetes monitoring, etc. So primarily, these are diagnostic centers which you are offering, across the country, and not retail healthcare services, which would be probably medical-related services such as, hospitalization, etc. Just want to make that clarification.
Yeah, so basically wanted to just clarify. Firstly, thank you for the opportunity. Yes, we are coming up in the B2B and B2C segment. To be more specific, instead of just starting 600 diagnostic centers would not be the right comment. We are leveraging our pan-India network where, we've proven ourselves to be the best premium diagnostic service provider. So we are going to tie up and with small labs, hospitals, and make sure that we can leverage our existing facilities. And we will be the, I think, first one to have integrated diagnostics facilities wherein we will be offering radiology and pathology services through these B2C segmented 600 plus diagnostic centers. So we are now entering into a new market which was untouched by us. Yes, there are several players. We have always been largely known to be a PPP service provider. But post-pandemic, we saw a lot of people wanted these kind of services. And hence, after working on a suitable model, we have decided to enter this market.
Just wanted to understand the economics of this, Pallavi. These 600 centers that you have planned to open or enter into partnerships, etc. What is the kind of money that you will be spending on that? And by when do you reach that 600 number? And secondly, what's the kind of revenue you anticipate coming in from this?
Yeah, so it is going to be an asset-light model, as I informed earlier, that we already have established ourselves in the market. We are now only going to leverage our network. We are going to strengthen, we have already strengthened our back-end support system, which is, our IT infrastructure, our labs. So it will be more like an asset-light model, wherein we are not going to invest more in making infrastructure investment. We are leveraging the existing infrastructure, what we have in the states. We are present in 16 states, 2 union territories at about 2,000 plus locations. And we are just going to leverage this network and start this model. Revenue, we are going to be, as you know that Krsnaa is known to be one of a premium service provider, but at the same time giving all these services at a very, very affordable cost to the public. And this is also going to continue because that's the vision we have seen, that to get affordable and accessible healthcare at the doorstep. So we are not going to deviate from that motto of ours. Right now, currently, immediately telling you about the revenues would not be appropriate because we are starting it, and as we have shown results in our previous business models and our past experience, we are sure to create a difference.
Sure. I think what my colleague was also trying to understand more than revenues is break-even, right? Because these are 600 new centers that you will be launching. What would the operational efficiencies be of this? When do you think you can break even on these centers?
So that's exactly what I'm telling you. We are not going to invest in the infrastructure in making these diagnostic centers. This is going to be a tie-up with small laboratories, small hospitals who have reached to us and are willing to partner with us. And we are going to leverage the existing network. What we have, we are already present in hospitals, we are already present in government facilities, we are already present pan-India at multiple locations. So it will be more like a logistically driven planning we will do. And that's the reason there won't be much of investment to be done here. It's going to be a very, very asset-light model. So I don't think we are worried about break-even. I think we would be able to start getting in and building in our revenues the day we start the project.
Okay. Pallavi, you know, as we all have seen, the entire diagnostic industry has completely changed post-COVID. There's intense competition within this space, and diagnostic companies themselves are now foraying into radiology simply because it's parallel, it probably provides even higher margins, and they need growth at the end of the day. So what makes you think that these 600 centers, despite the fact that it is going to be an asset-light model, is going to differentiate you in any way against the competition that the industry is facing?
Yeah, absolutely. The new entrants will have to, build everything from the beginning, develop, make the centers, make investments in infrastructure. We have already proven ourselves to be a premium service provider. Our services are, being appreciated by the public at large. During COVID also, we were very, very well accepted by the common people where we want to reach them. That, the rates are very, very low. Almost, if you compare us with any of our competitors, we are 60% lower in our radiology sector, and we are almost 80% lower in some of our pathology tests, which already gives us a upper hand in the market. And with the experience, expertise and the team we have, I'm sure we will be able to create a difference. What we've done in the last 10 years, we continue to grow, and we will continue to make the difference to the society and make sure that, best quality healthcare services reach to masses and common people of our country.
Right, and we thank you for that as a community, for, ensuring that it is affordable and it takes care of the community at large. But just final couple of numbers, if you could give us, incremental volume growth, what could it be on account of this foray that you've done? And secondly, will at any point your average revenues per user be, per patient be compromised because of this, or will it increase? How much can it increase by? Last year you did around 975 rupees per patient.
No, so I don't think so. It will increase for the user at large. Yes, of course, but definitely, as mentioned earlier, that we are coming up with genomics, we are coming up with some super specialty tests, that whenever that kind of test is required by people, it will definitely be at a different cost. But yes, all put together, it will definitely be lower than the private market rates. In terms of volumes, we are expecting to take this in phase wise. So maybe, once we do a phase one in about 100-150 centers, we will be able to complete this entire 600 centers in say about 6 months time. And only then we will be able to come up with numbers. Right now we've considered to just come in the market because that's the need of the hour, and reach out to people where our services are needed.
Okay, all right, Pallavi, we're going to leave it on that note. Thanks very much for joining in and speaking with us. So that's largely a repurposing of, or maybe even a tie-up of to launch diagnostic centers across the country. That's Krsnaa Diagnostics. If you look at it as compared to its 52-week high, it's been a significant underperformer, down around 40% from those levels.
It's like routine course of business for them, right? This is what they
largely,
do.
Yes, they're not. Yeah, they're just going, and they're just sort of going to do what they've already been doing. They have a presence in radiology and diagnostics. But maybe get into more high-end testing, which a lot of diagnostic companies are already doing. Yeah. So this is maybe providing an integrated service in healthcare centers which they will do via tie-ups. Let's see how it adds in terms of revenues, but this is what Krsnaa Diagnostics' plan is. Time for a break now. Sameer Jawan will join in to discuss the technicals next. Stay tuned.